Next, I'd like to introduce our speaker today, Dr. Natalie Solomon. She is a licensed psychologist who specializes in the treatment of sleep disorders. Her clinical interests include the intersections of sleep difficulties with overall quality of life, women's health, and mood disorders. Dr. Solomon has a background in chronotype research and enjoys integrating her research knowledge into her clinical work. She's joining us from the Sleep Health and Insomnia program of the Department of Psychiatry and Behavioral Services at the Stanford University School of Medicine. Dr. Solomon, why don't you take it away?
Great, thank you so much. Not much need to introduce myself because Twin did such a nice job, but yeah, my name is Dr. Natalie Solomon. I'm on the clinical faculty at Stanford, where I spend half my time treating patients with sleep difficulties, specific interest in the intersection of sleep difficulties and women's health. So often, sleep struggles in the context of pregnancy, postpartum, menopause, or other things like that. And I spend the other half of my time researching sleep. And we'll talk a little bit more about research later. And in addition to my role at Stanford, I'm involved in some research at UCSF, looking at interventions for sleep difficulties in the context of pregnancy. And I do some consulting for apps in the area related to sleep. So just to kind of get us started, I wanted to get everyone's brain working a little bit. So I'll be quiet for a minute. And if you don't mind taking a minute and thinking, when your mind is very busy, how do you quiet your mind? So just maybe identifying one or two things that you do to quiet your mind. Oh, wonderful. Someone put a response in the chat. Sitting still, exercise. I also thought of exercise, going for a walk, closing eyes, deep breathing. These are wonderful. So yeah, there is a huge variety of things people can do to quiet their minds, and we'll talk about kind of where this comes into sleep work. So this is just kind of an outline of how we'll spend our time together today. We've already done introductions. We'll talk about how to optimize sleep. So some ideas that you could start implementing tonight. Talk about the relationship between stress and sleep. And then this word chronotype. Chronotype is really the scientific word for if you're more of a night owl or a morning lark. And we'll talk about kind of what that means, how you can best navigate that. Then we'll talk about sleep disorders. So when you might want to seek extra support. And then if we have time, this last one, ways of think about insomnia and the treatment of insomnia. We may or may not get to that last one because I want to make sure we build in some time for questions. So Twin will kind of take questions down as we go along and we'll address them at the end.
Yep.
Wonderful, thanks. So the first piece is how to optimize sleep. So I think this talk is the most interesting if you consider it kind of like a workshop for your own sleep. My hope is that there's something said today that you can kind of hold on to and think about as a sleep tool in the future. So I guess we'll start with last night, if you sleep at night, if you work at night, the last time you slept. I'll be quiet for a moment just so you could try identify about how many hours of sleep you got last night. So just thinking about last night, maybe an estimate of how many hours of sleep you got. And then I want to ask you just to reflect for a moment, what kinds of things get in the way of getting more sleep? And you're welcome to put some of those barriers in the chat. So what kinds of things make it hard to get more sleep?
Overheating.
That's a great one. Temperature.
Mm-hmm.
Someone said mind occupied, working out late at night. Childcare. I don't know if that applies to anyone. Elder care. needing the bathroom, stress?
I think for me personally, it's always finding the right position to sleep in.
Mm,
Is my pillow too tall or too low? I'm not sure, but I think that sleeping and neck pain
mm,
are really related for me personally.
absolutely. I mean, pain is a great one, getting comfortable, which you're also kind of speaking to. Yeah, absolutely. So, one of the first things I wanted to talk about in terms of optimizing sleep is sleep effort. Um, so you guys have maybe seen one of these before. This is one of those finger traps. So you put your fingers in both sides, and when you pull hard to get out, you get stuck. And the harder you pull, the more stuck you become. And this is an illustration for when we try very hard to sleep, it can sometimes become very difficult to sleep. And the way to get out of this is to actually stop trying. You kind of like relax your fingers, and then taking them out becomes easier. Sleep can be like that too. So basically, the main point here is sleep effort is trying very hard to sleep. And trying very hard to sleep is actually unhelpful and maybe even counterproductive. And so, a theme throughout entire conversation today will be that you cannot make yourself sleep. And so, one of the ideas is actually finding ways to do something else until sleepiness comes and finds you. So, we'll be talking about different ways to engage with this tool. But one of the main points is if you ever catch yourself laying in bed trying very hard to sleep, we actually recommend either getting up or sitting up and doing something else until you feel sleepy. So, to try to avoid strong sleep effort. You don't need to chase sleep, but rather waiting for sleepiness to come and find you and doing something kind of relaxing in the meantime. This finger trap is one metaphor, but one that's used often is quicksand. If you struggle in quicksand, you just sink faster. You're actually supposed to kind of try to stop struggling, which moves you closer to your goals. So here, in the top left, we have someone laying in bed awake. And, she looks kind of frustrated. Over time, the bed can become paired with being awake, maybe anxious, maybe frustrated. So if you're struggling with your sleep, we recommend minimizing the amount of time spent in your sleeping position awake. So what do we mean by that? There'll always be a little bit of time because it takes a little time to fall asleep and time to fall back asleep after you use the bathroom. But if you find yourself awake for an extended period of time, what feels like more than 30 minutes, we actually recommend getting out of the sleep position, whether that's getting out of bed or sitting up in bed. You could switch to the sofa and doing something else until you feel sleepy. So the main point here is that we actually want to pair the bed with feeling really relaxed and sleepy, and largely reserving the bed for sleep only. We normally say the three S's: sleep, sex, and sickness. And if we're doing other things, to actually move those activities somewhere else. So a question I often get is, like I like to watch TV in bed. Um, that's not the end of the world. Many of us do. But if you're struggling with your sleep, it can be really useful to move those activities out of the bed so that the bed becomes very paired with resting and sleeping. If you don't have another comfortable place that you could go, or because of pain or other reasons, the bed is really the place where you spend time, that's when we recommend just making your position as different as possible. So whether that means propping yourself up on pillows, maybe even being on top of the covers, things like that, to really distinguish between the position when you're awake and doing something else and the position when you're resting or sleeping. When we think about this model of conditioned arousal, the bed becoming paired with being frustrated or anxious, it also brings to mind, you can imagine the impact if someone's experienced trauma in the bed or at night. So being really thoughtful about kind of reestablishing the relationship with the bed to be one of rest and relaxation. So this concept of quieting the mind, this actually already came up in the chat, when we kind of talked about One thing that can make it hard to sleep more is a very active mind. So some strategies to help quiet the mind at night include winding down time before bed. So I think this is kind of interesting. It just really takes some buffer time to transition from a busy day to a restful night. And so I normally recommend taking at least 30 minutes, but more is even better, to really shift gears. And during this time, you could read, watch TV. We'll talk about that blue light piece. Listen to a podcast, but just basically doing something kind of relaxing to let you transition to the night. I actually think winding down can be more important than sleeping, as in, even if it's late and you're like, I really should go to bed, it's probably worth it to wind down because when you do finally sleep, the quality of the sleep will be better. The second mark says, go to bed when you are sleepy. So we normally recommend trying not to get into bed until you actually feel some sleepiness. And that might be a little bit later than you think. Feeling sleepy is different from feeling tired because tired is fatigue. We can be fatigued of mind, fatigued of body, and both. So for example, at the end of my workday at like 6 p.m., I'm tired, I'm fatigued of mind. My brain is a little bit like dopey, but I'm not sleepy. If I were to lay down at 6 p.m., I probably wouldn't fall asleep. So one idea is to actually keep yourself out of bed and winding down until you feel a little bit of sleepiness. Until once you feel maybe those heavy eyelids or like you kind of want to lay down and close your eyes, that's your cue to go to bed. This third one is avoiding the clock in the night. So it's a very relatable experience that if you see the time in the night, many of us start to do some mental math, myself included. How long have I been asleep? How long till I have to get up? How long have I been awake? Oh my gosh, it's another hour has passed. And all of that is kind of activating. It makes it even harder to unwind and rest and maybe fall back asleep. And so we kind of like this idea of whether you're awake or asleep, your window at night, assuming you sleep at night or during the day, is protected for resting. And so to try to protect yourself from the time, because it's kind of activating for our brains. And then these last two are two different strategies that I want to offer you guys that are to help quiet the mind at night. So the first one is scheduled worry time. The idea behind scheduled worry time is that sometimes we have concerns that are like humming on the back of our brains throughout the day, but maybe we're distracted throughout the day. We're doing other things. Maybe there's people around. But at night, sometimes our concerns can really flare up. So I think of it as like a balloon with a little bit of air in it. It's kind of squeezed down during the day and it pops up at night. Scheduled worry time is to try let a little bit of air out of that balloon during the day. So the idea is to actually sit down for 10 minutes and do what we call a little bit of constructive work on your worries. So that could be journaling about your worries. That could be, picking one or two for the day and just identifying which components are in or out of your control. So it doesn't actually fix anything, but you're kind of processing your concerns and changing your relationship to them. Then the next step of the practice is if concerns come up at night, you really remind yourself, I gave this my attention during the day. I'll give it my attention again tomorrow. I don't have my best thinking mind now anyway. And so it's really about kind of postponing, reminding ourselves now is not the time. I'll think about this tomorrow when I can think more clearly anyway. Now is for resting. So that's scheduled worry time. And then the last bullet on this slide is closure to the day. So the idea behind closure to the day is it is very hard to sleep when we feel like we have like loose ends, like lots of things to remember. But the thing about life is it's full of loose ends. So closure to the day is just taking some time at the end of your day to kind of organize your thinking about these ongoing projects, not necessarily finish everything, but maybe make a list of like, oh, these are the things I need to pick up later this month or whatever. It just helps kind of outsource the job so the brain doesn't have to remember and work on these things in the night. Okay, so now that we have gone through some tools to quiet the mind, I want to talk about some sleep compatible habits. So this first one, being aware of blue light exposure in the evening. So blue light is the light emitted from technology, so computers, phones, and iPads, and TVs. Blue light has a pretty high drop-off rate, meaning if you're watching TV in the evening, TVs tend to be far enough away from us that the blue light probably can't reach you. Devices closer to us, so iPads, computers, and phones, let off a blue light that can be disruptive to our sleep. So in those cases, we normally would recommend to look into one of those free blue light blocking systems. It's like, for example, on the iPhone, there's something called night mode that kind of puts a yellow tint on the phone that protects you from blue light. They also sell glasses, clear glasses. Actually, I might have some right here to show you guys. Yes, I do. That help protect against blue light. And these actually work pretty well. So being thoughtful about blue light exposure in the evening. I think the other piece of technology is just being thoughtful about content. So it's totally fine to watch TV before bed, but I probably wouldn't watch the news, right? Just because the content is actually pretty activating. The second bullet is being aware of liquid intake before bed and in the night. So often people really want to be careful to limit their liquid intake maybe 3 hours before bed, not to stop drinking completely, but maybe if you really hydrate before then, hydrate throughout the day. But maybe leading up to bed, if you drink some water, just holding a sip in your mouth. So maybe more like wetting your palate. As well as if you're waking up many times in the night to use the bathroom, it's more opportunity to drink. So just being thoughtful not to drink too much in the night. The third bullet is limiting naps to 20 minutes and trying to keep them 6 hours away from your bedtime. So if you go to bed at midnight, trying not to nap after 6 p.m. Sometimes people are surprised by these 20 minutes. It's amazing that a nap can be refreshing. That's quite short. So I normally recommend setting an alarm for, let's say, 30 minutes. And resting your eyes. We don't know if you'll sleep for 0 minutes, 20 minutes, 15 minutes, 30 minutes, and it doesn't really matter, but it helps to ensure that you don't oversleep. And then this last bullet, maintaining a consistent rise time. So one way to really improve your sleep is to pick a time and set the alarm for that time every morning, no matter what, even if you have a bad night. Because by rising at the same time every day, you're really keeping your circadian schedule very consistent. And so even after a bad night, maybe by setting the alarm, you lose an hour of sleep or something, but that means the next night you're more likely to sleep well. Okay. So now I'm back to asking you guys a question. If you could reflect for a second and just think of a night, it might have been recently or further in the past, when you had worse sleep, when you didn't sleep so well, and try to identify what was happening that night. It could be something internal, like you felt kind of anxious, or it could be something external, like, your husband was snoring. But maybe just taking a moment and thinking of a night when you had worse sleep and trying to identify one thing that was going on that night. So someone put in the chat, worrying about a work project deadline. That's a perfect example.
I'd also have to emphasize that for myself. Worrying about work definitely keeps me up at night.
Yes, that's a really relatable one. What came to mind for me was actually just a few nights ago, I heard a sound outside that intellectually I knew was literally probably the wind, but it was enough that it kind of woke me up and activated me in some way and made it hard to sleep. So many of what you guys were thinking about might have led you to a conclusion kind of like this one, which is that sleep is a vulnerable state. Falling asleep kind of requires the mind and body to be quiet enough. It's kind of a letting go process. And so it can be really hard to let go because sleep is a vulnerable state. So that brings me to talking a little bit about the relationship between stress and sleep. So I like to pause and kind of zoom out for a moment, which is, when we were evolving as people, our original stressors were like food insecurity, predators. And so it was really, these are the things that we developed our stress response for. And so you might have heard this before, but our stress response is our fight, flight, or freeze response. This is how we respond to stressors. And we originally developed this response to things like the lion in this photo. So a part of the fight, flight, or freeze response that people don't often talk about is that you're not supposed to be able to sleep, right? So you have an increase in adrenaline. Sometimes people have an increase in heart rate. Blood focuses on the major muscles. And you're definitely not supposed to be able to sleep. You're supposed to be able to respond to the stressor in front of you. However, although our stress response remains the same, this fight, flight, or freeze response, our stressors are quite different. So the things that we often deal with now are things like work stress, interpersonal stress, worrying about relationships, maybe financial stress, health concerns. And these stressors are so much less temporary, right? They feel, and they might actually be, never ending. So we're having this fight, flight, or freeze response in which we're not really supposed to sleep. However, the stressor never really goes away, at least in the lion situation. It was all over in 20 minutes. You either ran away or you fought the lion or you got eaten by the lion or something happened. But in our lives now, we can have this response in kind of an ongoing way. So I wrote here, the fight, flight, or freeze responses for lions and invisible lions, because when you notice you're having this response, it's your body's acting like there's an invisible lion in the room. So I mentioned that blood focuses on the major muscles. That's why some people experience clammy hands and feet, because it actually focuses on the heart and the big muscles. And so our hand and feet get colder, which is where this thermometer comes in. So I'm just kind of using this thermometer to illustrate something. I actually have one of these in my office, and you can attach it to your finger, and you can think about something stressful, and you literally watch the temperature in your hand go down. Your hand's getting colder because you're inducing a little bit of a fight or flight response. And then, if I'm working with someone one-on-one, maybe we'll do one of these exercises, a relaxation exercise, and you watch the temperature in your hand go back up. So, I use this to illustrate, although we haven't resolved the stressor, the stressful thing they were thinking about, you do actually have some play over turning the dial up or down on that stress response. So the goal for sleep is to be able to turn the volume down on the stress response just a little bit at night so that you can rest. So you might be wondering, how do we do this? How can you actually turn the dial down on the response? There's some examples here, and maybe if we have time at the end of our talk, we can go through one of these together. Diaphragmatic breathing is belly breathing. So that is, you can try placing one hand on your chest and one hand on your belly. And you're trying to move the hand on your belly a little bit more. So you're really engaging your diaphragm with the breath. Progressive muscle relaxation is going through and tensing and releasing muscles. So maybe we'll just do one together now. So if everyone could inhale and gently tense the muscles in your fists and arms. So inhale, tense. Exhale, release. And we'll do the hands and arms one more time. Inhale, tense. Exhale, release. So progressive muscle relaxation goes through different muscle groups in the body in that way. Imagery is bringing to mind an image that brings about relaxation for you. So it could be a place, Many times people choose somewhere with water, maybe at the beach or something like that, and kind of bringing it to mind as fully as you can, like a 3D movie, so you'd really be imagining, what do I feel on my skin? What do I see? What do I hear? And much more. There's other ways to kind of turn the dial down on that response. CBTI Coach is an app with free resources. They're guided, so you can kind of click around and they'll lead you through some of these exercises. One note I wanted to make is, I've been framing this in terms of stress, but it doesn't always have to be negative. It can be, like often kids can't sleep before holidays for the same reason, they're having this kind of activation response turned up. Many times people can't sleep before flights. It's part excitement, part, maybe unrealistic anxiety about missing your flight or something like that. And so it's kind of an activation response. And so the goal isn't to shut it down. It's good to be activated, but trying to turn the volume down at night so that you can rest. And then you can turn the volume up during the day if you want. I'm just going to check the chat just in case there's a question I can answer in the moment. Oh, yes. Yeah, people saying Wari is being too hot. Okay. So now a slight shift in topic, but related, which is this term chronotype. So chronotype is the natural inclination of your body to sleep at a certain time. It's what most people understand as being a night owl or an early bird. And in addition to regulating sleep and wake times, chronotype has an influence on appetite, exercise, melatonin, cortisol, core body temperature. So our chronotype really is our body's internal clock and timing. Okay, a few important things to know about chronotype. Basically, we have an internal clock. That's our circadian rhythm. And our clocks are slightly different. So if we start with the clock component, we first discovered that every organism that we've so far discovered on Earth, so like animals, plants, single cell nuclei, have these internal clocks. And it was actually first discovered by a French astronomer who discovered that a mimosa plant opened and closed at the same time every day. Open and close. So we said, oh, it must be the sun. But they put the plants, in a dark lab basement, and they continue to open and close at the same time every day. So they basically found out the plant has a clock in it. It has a near 24-hour clock. And humans are the same. We have an internal clock that tells us when to be alert, when to be sleepy, when to digest, when to be hungry. And this is why we experience jet lag, right? We go somewhere new and our internal clock, thinks it's a different time of day. Chronotype is the timing of that clock. So some people get cues to feel sleepy later than others. Some people get cues to wake up earlier than others. Our chronotype tends to be relatively stable across our lifespan. So often people remember, when I was, in my 20s, I was a night owl, and I'm still kind of a night owl. Or the opposite, like I've always woken up early, it's always been the case. There are some changes. In adolescence, we tend to be a little bit more night owl type. And as life goes on, we tend to get a little bit more morningness as we age, as well as sometimes, things are demanded from us in life. So jobs and children, different responsibilities can make us adapt to a different schedule that might not be our body's natural inclination. And so a big thing I want to say here is that a huge part of chronotype is explained by genetic variance. So we think we are, largely wired a certain way, and there's a strong genetic component. Okay, so there's nothing wrong with going to sleep later and sleeping in later, or going to bed early and waking up earlier, except that many people experience kind of a misalignment with society's schedule. So what do I mean by that? Society expects us to sleep something like 11 p.m. to 7 a.m., something like that. That's kind of like when restaurants expect you to be able to come, grocery store hours, things like that, jobs, school buses. There are people who feel alert, maybe until 2 a.m. And it's very difficult to wake up, maybe before 10 a.m. So they tend to be on a slightly later schedule. And we call those night owls or delayed phase. And then there are people who might have a very difficult time staying awake past like 8, and they might have a very difficult time staying asleep past like 5 a.m. And of course, there are shades of gray. And so, sometimes there's this social stigma, especially around being a night owl. We kind of say these things like early bird gets the worm, as if it's like good to wake up early. When in reality, it's actually good if one can to align your schedule with your body's natural preference. So if you are an early bird, to the extent that you can, it's not the worst idea to maybe sleep from, 10 p.m. to 5 a.m., even if your partner doesn't, or even if other people don't. Tends to be the best health outcomes when we can align them. And of course, sometimes we can't. Maybe you're a night owl, but you have to get up at a certain time because that's when the bus leaves. In which case, the best way is to consistently make changes. So to consistently rise at the same time, try not to do like weekend catch-up sleep. But often we look for a middle ground. Like, is it possible to stay awake a little later and sleep in a little later than you currently are? One more piece that I wanted to mention about this chronotype scheduling is that we use this term social jet lag. And that applies for when you experience almost like a jet lag between your body's natural preference and the society schedule. Most commonly found in night owls, who are trying to be on more of a morning schedule. And it really is a jet lag. It's this misalignment between when your body wants to sleep and when society wants you to sleep. The last piece is that it's a little bit, there's a genetic component where for night owls, it can be very difficult to rise in the morning. That's so common that there is a term for it called sleep inertia. So if you are a night owl and if you have trouble rising in the morning, that makes sense. There's a biological reason for that. You actually likely have a longer tau of your circadian phase. But the best things are consistency and getting light and getting upright. So if you can get yourself up and near a window, that groggy feeling, that sleep inertia feeling will dissipate more quickly. So because we're talking so much about sleep, I briefly want to mention other sleep disorders, just in case you're experiencing any of these symptoms. So some people experience, a burning or aching sensation in the legs in the evenings that is relieved with movement. So it makes you really want to move your legs. And if you are experiencing these symptoms, it could be a sign of restless leg syndrome. The second orange bubble refers to snoring, choking, or gasping for air in the night, which could be a sign of sleep apnea. So not all snoring is sleep apnea, but it can be one of the symptoms. So if you're experiencing these symptoms in the orange bubbles, it might be worth bringing them up to your doctor, just in case they are indications of restless legs or sleep apnea. Okay, so we've talked about normal sleep difficulties. So things like noticing the impact of stress on sleep, having trouble falling asleep at the right hours that you might want, maybe because you're a night owl or a morning bird. And I quickly want to talk about, the difference between sleep difficulties that we all experience and when something might be an insomnia disorder. So disturbed sleep is an insomnia disorder when it's associated with daytime distress or impairment. Insomnia requires adequate opportunity to sleep with inadequate ability to fall or stay asleep. So meaning it's not insomnia if you're working 3 jobs and you just don't have enough time to sleep. But if you do have an okay window for sleep and you're having a really hard time falling or staying asleep, that could be insomnia. I want to note that sometimes the coping behaviors that people adopt to better navigate their sleep actually become a part of the problem. And we'll talk more about this later, but things like, if you're struggling with your sleep, you might start going to bed earlier or taking long naps in the afternoon, maybe sleeping in when you can, maybe worrying a lot about your sleep. And you can imagine how all of those things actually could lead to further disrupted sleep. And so sometimes the way we navigate sleep disturbances become a part of the problem. Some people also become very focused on their sleep, and this focus tends to perpetuate sleep difficulties because it can increase our anxiety about sleep. So over time, sleep disruption that might have started as just normal changes in sleep, maybe associated with pain in the night or using the bathroom, can become an insomnia disorder because of some of these behaviors that we might engage in. If you are experiencing insomnia, the gold standard of treatment for insomnia is actually a non-medication treatment. It's short-term and skills-based, and it's called CBTI, which stands for Cognitive Behavioral Therapy for Insomnia. There's quite a bit of evidence to support CBTI, and CBTI can be done individually as well as in a group format. CBTI is offered at many medical settings. Obviously I work in a clinic at Stanford that offers CBTI. And you can also get connected to CBTI and other sleep treatments through research. And I'll briefly mention some research opportunities. There's pros and cons. A pro of research is you can often get seen more quickly. There's not wait lists. But a con is, depending on the research, there might be different kinds of eligibility criteria. In some treatments, they have a CBTI condition and then maybe also an experimental condition or a different treatment condition. So I briefly want to mention two studies that we have going on at Stanford, just in case anyone's interested. I'll make this part very brief, but one study we have is Luna. And you would be eligible for Luna if you are over 60 or over and experiencing some kind of memory concern in addition to symptoms of insomnia. So you're struggling with your sleep and maybe having memory concern. And basically what we're looking at in this study is, if we improve sleep, does the brain change? So we're also doing fMRIs of the brain and looking at other symptoms, so other kind of mood symptoms or memory-related symptoms. The second study that I wanted to tell you guys about is the TIRED study. So you would be eligible for TIRED if you are between the ages of 25 and 60, and you're currently experiencing some mood symptoms, so maybe some depressive or some anxious symptoms, and you reside within 50 miles of Stanford. And again, we're looking at, if we improve sleep, how does the brain change? Do other symptoms change? I also wanted to mention some apps and books that can be good for self-help. So we have this website, Insomnia Coach, as well as A Path to Better Sleep. We have this app from the Cleveland Clinic and Sleepio. And then this book I put at the bottom is a book that I really recommend called Quiet Your Mind and Get to Sleep by Carney and Manber. And it goes through in much more detail some of the pieces that we've talked about today. So this is one model to think about insomnia or sleep difficulties, and also a way to think about the treatment of sleep difficulties. So it's kind of a frame of reference. So down here, the green refers to predisposing factors for sleep difficulties. So we all just have a different level of predisposition to sleep difficulties. Sometimes people who are lighter sleepers might be more predisposed to sleep difficulties. They're more likely to hear sounds in the night or get uncomfortable and roll over. Identifying as someone who worries, a worrier, you might be more likely to develop sleep difficulties, sometimes having direct family members who have struggled with their sleep. So we all come in with just a level of predisposition. The red box refers to precipitating factors. These are things that kind of throw us over the threshold, and now we're struggling with our sleep. These could be a stressor, a life change, a new job, menopause, things that happen that kind of throw us over and now we're struggling with our sleep. Over time, actually naturally goes down. So even if something threw us over the threshold, as time passes, naturally it goes down and we are below the threshold of struggling with our sleep, except for this yellow box. And these are perpetuating factors. So we kind of touched on this earlier. These are the things that sometimes we do because we're worried about our sleep or in an effort to better control sleep that become a part of the problem. So this can include things like spending too long in bed awake. Maybe we're struggling with our sleep, so we want to give ourselves a ton of time to sleep. So we spend lots of time in bed. Maybe we snooze the alarm a lot in the morning because last night was really hard. Maybe we sleep when we can, whether that's in the afternoon or in the morning or at night. We're tired, so we sleep whenever we can. And it's these kinds of things that actually can perpetuate our sleep difficulty. So another way of saying this is sometimes what started our sleep difficulties is not the same as what's continuing them. So sleep difficulties might have started in the context of like pain, for example. But what's maintaining them are some of the habits we might have adopted. In CBTI, you're really targeting this yellow box. You're really thinking about what kinds of things are we doing now that we can adjust to improve our sleep. Okay, so that's one model of sleep difficulties. And I'm going to offer another one from a slightly different perspective. And this next one has some ideas about how you could start improving your sleep tonight. So sleep is regulated by three main processes. One of them we call process S, and that's the sleep drive. So can you see my mouse? Twin, can you let me know if you can see my mouse?
Yes, I can.
Okay, great. So we're looking at the graph of someone who's asleep between these white bars. So they're sleeping from like midnight to 9 a.m. So I want to point out that sleep drive is like your appetite for sleep. You can think of it that way. You want a strong appetite for sleep going into the night. So for this person, as the day goes on, they're building up a stronger and stronger appetite for sleep. And after they go to sleep, their sleep appetite slowly declines. So you can imagine if this person took a long nap in the evening, it's kind of like having a bagel before dinner. It like spoils their appetite for the night. So it's not that all napping is bad, but very long or very close to bedtime napping can spoil our appetite for the night. I also like to tell people that sleep drive is not purely like a psychological construct. There's actually a chemical that builds up in your brain called adenosine. And so one strategy is if you're having trouble kind of winding down for the night, is actually delaying your bedtime a little bit. By pushing your bedtime a little bit back, you have more time to build up sleep drive, therefore build up a stronger appetite for sleep. Okay, now we have this one on the bottom, which we talked a little bit about already, which is the circadian clock, which is basically that timing matters. So our body sends out like an alerting signal. I want to point out there's like a dip in the alerting signal in the afternoon. The timing of this dip is different for different people, but if you ever get kind of like sleepy around now, that makes sense. There's a little bit of a dip in alertness then. There's also a strong push in alertness right before we go to bed. Sometimes people experience this as like a second wind, something like that. And then after we go to sleep, alertness really fades into the background. So if we put the two together, as the day goes on, we're building up a stronger and stronger sleep drive. As our appetite for sleep gets stronger, our body sends out an even stronger alerting signal to help keep us awake and alert. And after we go to sleep, the sleep drive gradually declines and the alerting signal kind of fades into the background, if everything's going well, right? So when I first brought up this model, I mentioned that there are three processes that impact our sleep. So we have one here, sleep drive. We have the second one here, the circadian clock. And the third one is the one that we've talked about throughout today, which is that activation can come from stress. It can come from excitement. It's that fight or flight response for lions and invisible lions. And that can mean that even though sleep drive is functioning well and your circadian clock is functioning well, you might just have more activation at night. That makes it hard to rest. So when in doubt, you want to try decrease the activation at night and increase your appetite for sleep, increase your sleep drive by keeping a consistent rise time, being thoughtful about naps, maybe even delaying bedtime, and limiting time awake in bed in the night. So that brings us to the end of our presentation for today. I see lots of questions. So I'd like to open up the conversation for some of your questions.
So the first question here is, how do you deal with overheating and anxiety, racing mind? This person has tried everything, dim lights and wait for 20 minutes, nothing works. What would you do? What would you respond to that?
Yeah, so in terms of overheating, it depends what kind of overheating we're talking. If we're talking a hot flash in the night, sometimes I recommend just making it so you can get comfortable after as quickly as possible. So whether that's sweat wicking pajamas or sheets, whether that's, being able to like put a washcloth on your face after. So it's more about returning to baseline after a hot flash. If we're talking about more general overheating, then different ways to think about being cool at night. So being thoughtful about fans, air temperature, what we're wearing, because it's true that sleep is actually best when the room is dark and quiet and cool. So we do a little better with cool for nighttime. Anxiety at night absolutely plays a role. And so I don't know that I can package up exactly what would be helpful for your anxiety quickly, but I would say things that help turn the dial down on that response at night. So it's wonderful that you've tried the advice of getting out of bed after 20 minutes. I would encourage you to keep trying that. It's not that it makes you fall back asleep quickly. It's that it can help you build up a sleep drive. It protects your relationship with the bed, and it allows you to just do something else, which can be kind of calming. So I always say what you do when you get up matters too, to actually do something restful, whether that's reading or watching TV. The last piece that I was thinking of is that, and you might need to work with a provider on CBTI on this. I wouldn't want you completely trying on your own, but it can be helpful to actually limit the amount of time that you're in bed temporarily. So for a few nights, really limiting your time in bed, maybe you say, I'll only, and this is, I would need to know more about your sleep. So take this with like a lot of grains of salt. But when I first start working with someone, if they tell me, I'm sleeping about 6 hours a night, we might temporarily say, why don't you only spend 6.5 hours in bed per night? So they can decide where they want to put their 6.5 hours. Maybe they decide midnight to 6:30. And so they would actually keep themselves out of bed until midnight, go to bed anytime after midnight when they feel sleepy, and then get up at 6:30 no matter what. And so you can imagine by limiting your time in bed, you actually really bring up your sleep drive. By a few nights of doing this, people start to sleep through a little bit more of that window. So again, that's just an example. I wouldn't recommend those hours or that amount for anyone. But that's a component of CBTI that can be really helpful for people struggling with anxiety at night.
Oh, thank you for that. Our next question, what if you never feel rested no matter how much sleep you get?
That's a wonderful question. So that makes me think that it might not be about sleep duration. So for example, when we talked about, and this is just an example, when we talked about how snoring can be a symptom of sleep apnea is the partial or full stopping of breathing in the night. So sometimes people don't even know what's happening, but they feel really unrefreshed during the day. And if they go for a sleep study, they actually find out that multiple times throughout the night, they're waking up without any memory of it and falling right back asleep. So it could be the quality of sleep. There are also some sleep disorders which lead people to never feel or to feel less refreshed, maybe narcolepsy or hypersomnia. So again, I would recommend talking to your doctor and maybe doing a sleep study. And then the last one is fatigue is really multifaceted. How we feel is in part related to sleep, but in part related to many other things. It could be related to burnout, depression associated with isolation and COVID. So there can be many factors that can lead us to feel fatigued that are separate from sleep duration.
I think I'm not sure how related that question is to this next one, but on the other end, this person asks that or says that they have a friend who sleeps about 5 hours a night, but is full of energy.
Yeah, absolutely. So, how much sleep we need really varies person to person. So, it's actually a myth that everyone needs 8 hours. It's a very unhelpful myth. So, there are people that sleep maybe 5 or 6 hours and they feel good. There are other people that, if they get less than 9, they really don't feel well. So, using your own internal gauge is better than aiming for a certain number that you might have heard from other people.
That's really helpful. I didn't know that the 8 hour a day was a myth.
Mm.
That's really helpful to learn. This next question does get a little bit specific to the individual. They say that they have chronic pain, which they minimize with OTC acetaminophen about 1,200 milligrams a day, and they feel a lot of pain all the time. I didn't see a specific question related to sleep, but I want to perhaps assume that it's affecting their sleep, the pain.
Yeah. Well, firstly, that sounds like a lot of suffering. Um, One point of hope is that, even if sleep disturbances are in the context of chronic pain, CBTI and many of the tools still work. So it might not resolve the pain, but it is possible to improve sleep even in the context of pain. And so, if you find yourself really struggling with your sleep, even if it feels, directly linked to pain, it might be worth talking to your doctor to see what kinds of options there are for your sleep.
I'm also interested in this next question. Why do our sleep patterns change with age? Is it a brain modulated change?
Yeah, there are a few changes in sleep associated with aging, and some are related to the brain and some less so. So, one is that we actually tend to sleep shorter as we get older. So, you might have remembered sleeping 7 or 8 hours when you were younger, and now you feel good on 6 or something like that. The other is that our sleep is a little bit more fragmented. And that is in part due to the amplitude of our circadian rhythm is a little bit less. So, people maybe wake up more in the night. The part that's not so brain modulated is that you might just need to use the bathroom more. It might be harder to get comfortable. Um, the two more changes associated with aging that I think are good to know. One is that I mentioned before, there's a shift towards morningness. So you might find yourself waking up a little bit earlier than you used to. And the last thing is that as we age, we're actually more resilient to the impact of sleep deprivation. So I think this is kind of cool, which is that young people, when they don't get enough sleep, they're like falling apart, not performing well.
I
As we
completely feel the opposite, and I'm so surprised that you're saying that.
I know, isn't that fascinating? As we age, and when I say age, I mean older adults, when we're in our 60s, 70s, 80s, we're actually more resilient to sleep loss. So we can perform pretty well even after we've gotten suboptimal sleep.
All right. That was really interesting. The next question is about body orientation, which would be more effective for a good night's sleep? Sleeping on your back, on your side?
This one really depends. For some people with sleep apnea, they're trying to train themselves to sleep in a different position. In pregnancy, we try not to sleep fully on our back for too long. So I would say, however, you're comfortable, unless you have indication from your doctor that one position is not good for you.
Next question, dealing with sleep issues after a major life event, such as breast cancer treatment.
Yeah, this is an excellent one. I'm very interested in sleep in the context of cancer, especially in women's cancers. So there's a lot of things about cancer that can lead to sleep difficulties. There's change in lifestyle, there's actual chemo, there's the stress of navigating cancer, and there's actually things about the tumor biology itself, as well as treatment that can disrupt sleep. So it absolutely makes sense to experience sleep disruption in the context of cancer or cancer treatment. Many of the same recommendations apply. So sometimes if I'm working with someone actively engaged in cancer treatment or having just completed it, we'll tailor some things. For example, the day after chemo might be a wash, the night after chemo. So we think about it like, don't worry about sleep tonight. Pass the time like as if you're on an airplane, whether that's watching movies all night, online shopping, whatever it might be. And then we kind of make a sleep plan to get back on track the next night, especially if chemo was later and involved a lot of steroids. So some individual tailoring, but in general, the same recommendations apply. And just knowing that the sleep disruption makes a lot of sense in that context.
Thank you for your response. The next question, can a person have a reverse sleep pattern with REM sleep at the end, not the beginning of sleep? This seems to be this particular person's pattern.
Yeah, so actually the REM does tend to be in the second half of the night. So the first half of our night tends to be our slow wave sleep, our deeper sleep. So the good news here is if you wake up halfway through your night, you never get back to sleep, you actually already got your deep sleep. And the second half of our night tends to include more REM, meaning if you wake up from a dream or a nightmare, you're probably closer to your alarm than you were to your bedtime. So the sleep pattern that this person is describing is actually the typical sleep pattern. In the context of depression, sometimes we see a little bit earlier REM. So we can see REM earlier in the night. But in general, slow wave sleep predominating the first half of the night and REM in the second half is what we tend to see.
Oh, very interesting. Next question, does sleep deprivation have any connection to stroke? Can a person heal their brain function through sleep? What about weight management?
So, I'm not sure that I can speak with full confidence about a connection between sleep deprivation and stroke. I do know that sleep deprivation lowers the seizure threshold. And so there might be a relationship there, but I'm not very familiar with the relationship between sleep deprivation and stroke. Brain function absolutely can improve with sleep as well as weight management. So the brain, we're still not sure exactly why we sleep, but we know that the brain cleans itself in sleep. And so it can be very helpful to brain function. I've worked with many people post-stroke on sleep and post-concussion and things like that. And definitely for weight management as well. Sleep is an important component of weight management. We think of it as a homeostatic process. So sleep allows us to kind of many body systems return to baseline. And so it can be an important component of both of these.
Thank you. Is being a night owl damaging to the immune system or health in general?
I love this question. No. I think we sometimes get messaging that it is. There's like a social stigma. We think it started when we lived in cultures with a lot of farming. So we wanted people to get up early, and there became this thing that it was bad to be a night owl. It's not bad to be a night owl. There is some connection between being a night owl and other difficulties, but we think it's because of the misalignment with the social schedule rather than being a night owl. So it can be very hard on you to be a night owl who always has to wake up at 6, just because it's hard. It's hard to make yourself fall asleep at an early enough time to get enough sleep. But being a night owl in and of itself does not damage the immune system or health in general. The ongoing social jet lag can be hard on a person.
Oh, I totally, I can feel that because I am a night owl. I feel like I get to do a lot more stuff, or I just have the drive to do more stuff at night.
Yeah.
I don't know. Nighttime just feels more fun. Our next question, what is the most effective, non-addictive, side effect-free long-term use sleep aid for a senior? That seems to be like a really nice magic wish kind of question, but I'm sure that you have a lot more realistic of an answer.
Well, I'm not sure I do. I would say, it really depends on the bigger picture of what else is happening in a person's life and health profile. This is a really good question for your doctor. And it actually kind of relates to the question right below it, which is is the goal for better sleep to be off all sleep medication? So currently, CBTI, that's that non-medication treatment we were talking about, has similar effects to sleep aids in the short term and actually much better effects in the long term. And so I only offer that to say, for many people, their goal, and it's individual, it depends on your life circumstances and other things going on, but many people have a goal to sleep well without sleep medication. which can be obtained with CBTI. But there are also many good reasons to take sleep medications, in which case speaking with your doctor about the best sleep aid for you, it's not a very satisfying answer, but that is my best advice.
No, you're doing your best. I mean, you have 30 people listening in, and many more who who asked these questions. And I think you're doing a wonderful job of answering as best as you could, given the information you have about all of these anonymous people. Well, we're almost done. We have two more questions left. And this next question is from a person with the disorder ADHD. They take medication to stay focused, and it doesn't interfere with their sleep and even helps them sleep on time by making them crash, I think. But it seems like good sleep isn't something that they normally get, and they wonder if it's forever.
Yeah, it's a great question. So there is a relationship between ADHD and sleep, in part because of attention in general, and in part due to the medication, which is often stimulants. I would say you are not at all doomed for bad sleep. Not at all. Many people with ADHD, find the tools that help them navigate sleep. It's wonderful that the medication that you take doesn't interfere with your sleep, because sometimes that's part of the picture is like timing of medication, dose of medication. It's not at all doomed for bad sleep. So there is definitely a relationship, in part due to attention and the brain and medication, but not at all doomed for bad sleep. Many tools still work in the context of ADHD.
Fantastic. Our last question in the Q&A, and this doesn't have to be the last question of today. Afterwards, we'll open up the floor in case anybody would like to continue the conversation. But Barbara, who's asked, what happens in our brains to change our sleep patterns after menopause?
Yeah, changes in sleep during perimenopause, menopause, and postmenopause related to many factors. So the brain, but also much else. So kind of we mentioned before, if you experience nocturnal hot flashes, that can be disruptive to sleep, both in the moment, right? Like you're having a hot flash and you can't sleep over it, but also after you've had this experience of being quite activated and uncomfortable in bed, there can be a lasting impact. Our muscle composition also changes in menopause, which can lead to difficulty getting comfortable, as well as other sleep disorders. So you might have never had sleep apnea before, but there's a change in muscle composition, as well as often weight changes in menopause. And then you could experience sleep apnea after, which could change your sleep quality. So there's lots of different, as well as, menopause and it could be natural menopause or menopause induced by surgery or cancer treatment. There's so many changes that occur around menopause, sometimes more life stage changes that can also lead to sleep disruption. So there's quite a few changes that happen in sleep in the context of menopause, and it's related to many multifaceted components. I did want to add, I hope I'm not being too repetitive, but we work with many people in our clinic whose maybe sleep difficulties started in the context of menopause. And although there is this hormonal and often muscle composition contributing factors, the sleep tools and the sleep treatment still works.
Wonderful. That was our last question from the Q&A, but that doesn't have to be the end of our discussion. If anybody would like to type another question in the chat, the Q&A, or even raise your hand and join us for a live conversation with your camera or your mic, raise your hand. You can raise your hand by clicking the button on your screen if you're on computer, or if you're on your phone or your iPad, you can open up the menu if it's like you see the three little dots. I have to say that I learned so many interesting things from your presentation today, Dr. Solomon. I really appreciate the host of vocabulary related to sleep health that you introduced, and also sharing information about CBTI. I think that new ways to improve sleep health, especially for me, is a really interesting topic. Louise here has a question, and Louise, you can unmute your mic when you can.
Okay. Is it unmuted? It wouldn't
Yes, we
unmute.
can hear
Okay,
you.
great. Thank you. Yeah, I put a chat question in the chat, but since it didn't get looked at, I thought I'd just ask. This is brilliant, and thank you, because I've had to do sleep webinars on sleep disorder where I work. I've done about 2 now. Maybe we've done 3 with the doctor I work with. And so a lot of information I've been hearing from you is a little bit more holistic and practical, such as not everybody needs 7 to 8 hours or 9 hours, and some other really important tidbits that I heard. Will this be recorded where we can actually re-listen to it?
Yes.
Because
so
now I feel more normal now.
I'm so glad.
yes, the recording is being, or the presentation is being recorded, and it will be uploaded onto CHRC's website. I will send an email out after this presentation that will give you a link of where to find the video when it's uploaded. And then you can also click on another link that's included in that email for a feedback survey. And when you fill that out, you can receive a copy of Dr. Solomon's presentation slides. Hopefully that will help you when you decide to look at the video recording later.
Okay, thank you.
Of course. Are there any other questions from anybody who'd like to get another discussion started, or if you just wanted us to reiterate anything, feel free to let me know. Otherwise, I think that we might be able to start our closing. Actually, Tony, please join us. I see that you've raised your hand.
I have a question. About circadian rhythms. After chemotherapy, I seem to have circadian rhythm dysregulation, and I don't know if it was just related to chemotherapy or low DHEA that I had after the chemotherapy, or why I had it. But I did work with the blue glasses and at night, and the blue light glasses and the light box in the morning, and it seemed to get better. But if I get stressed, it seems like it's easy for me to go back into that state where I feel like I have circadian rhythm dysregulation again. Is that really what's happening?
Well, Tony, what you're saying makes a ton of sense to me, which is, this started in the context of chemo. Afterwards, it seems like you got some tools that kind of got your sleep back on track. However, when stress comes up again, it makes sense to me that sleep becomes disrupted. I wouldn't, obviously I don't have very much information, but I wouldn't assume that something in your circadian clock isn't working right, but rather that the impact of stress can't be underestimated. And so sometimes the tools you have might be enough to keep sleep on track, but sometimes maybe the stress becomes higher than the tools. Does that make sense?
Yes, and the problem with the stress is that it magnifies my chemo brain, and then I forget to use my tools.
Absolutely. But
if I use them, is it likely that they would help?
Is what likely that it would help?
Is it likely that those same tools would help again if I remembered to use them when I got stressed?
Absolutely. You could even make yourself like a coping card, like writing them down when you have a little bit less brain fog, so that you have access to them when you really need them.
One of my brain impairments is that I can read something, but it does not trigger me to understand that I need to do what it says.
That makes sense. No, I think
that's a really bad impairment, but I try.
Or, you could talk to a loved one and have them prompt you when you could really use it. But I definitely think the tools would continue to help. And given our conversation today, I hope it also gives context as to why when the stress comes up, you see the impact on your sleep.
Yeah, it's really helpful. Thank you.
Of course. Thank you.
Dr. Solomon, we have a couple of questions that came into the chat here before we end our day. Barbara asks, or she still needs more clarification on the connection between sleep and weight, especially gaining weight.
Yeah, I'm trying to think. I think about the literature and what I can offer you. Yeah, Barbara, I'm not sure that I can speak to the direct relationship between sleep deprivation and weight gain. I'm actually not sure how well established that relationship is. I do know that in order to lose weight, there are many components of health that can be harnessed with improved sleep. So like, for example, if you're trying to meet health goals and eating in certain ways or exercising, it absolutely makes sense that having restorative sleep can be a component of that. As well as if you're really struggling with your sleep and your body's looking for energy, energy is calories. So there's a relationship there. Like sometimes we reach for sugar because we're tired, we're seeking energy. So, there's many layers of this relationship. Yeah, and it looks like someone else just wrote in the chat, I feel like sleep helps me make better choices with food. Sometimes I feel with drunk when I shouldn't. Absolutely. Food can be also a way to soothe oneself, right? And so we know there's a relationship between sleep and anxiety. So I know I'm not being super clear, Barbara, probably because there's so many facets and I'm not sure which ones do or don't apply to you.
Yeah,
I hope that
at
speaks to it.
Community Health Resource Center, CHRC, we have registered dietitians who do 8-week, 4-week classes on how your life can change around food and the behaviors that are attached to when you eat, or sorry, the feelings that are attached when you eat. And I definitely agree. Personally, when I am sleep deprived or very tired, I do get more anxious, and I do, my cravings do get a little bit more uncontrollable, and I eat more. But on that note, we have an emotional eating support group with a registered dietitian who works on these types of disordered eating, if you're ever interested. We have a person who's asking about melatonin on a regular basis. And I guess they just wanted to hear your thoughts on that. And Tony, I see your hand that's raised, and I'll go ahead and allow you to talk, but I think we'll answer the melatonin question first, if that's okay.
Sure.
So melatonin is used in two ways. One is as more of like a sedative or a hypnotic to help deepen sleep. And one is, I use this term chronobiotic, but it's to help us shift our scheduling. So like, for example, if you're having trouble falling asleep or feeling sleepy at an earlier time, that's more of a chronobiotic, trying to shift the timing. The dose of melatonin that people typically take is much higher than in our little world of sleep medicine than we would recommend. So for many people, the most effective dose tends to be something like 0.3 to 0.5, much earlier than you might think, maybe 6 hours before the bedtime that you'd like. So that's more from that melatonin as a chronobiotic perspective. Often I meet people who are taking melatonin to help deepen sleep. This really depends person to person. And the reason I kind of put that caveat is melatonin has been shown to have two other kind of totally different positive impacts. One is neuroprotective, so helpful for memory. And the other is sometimes oncologists suggest melatonin because it can kind of be a part of someone's post-cancer treatment or post-chemo treatment package. So those illustrate that there's a lot of individual variation. From a purely sleep perspective, it's not uncommon that people find that melatonin to help deepen sleep isn't that helpful versus melatonin as a chronobiotic. Some very small doses taken much earlier in the day can be helpful.
Thank you for that. Tony, let us know what was on your mind.
Well, what was on my mind, but now that melatonin is on my mind, the oncologist said that it's actually an anti-cancer formula, and in oncology, they recommend 20 milligrams.
Right.
So it's not uncommon for cancer patients to be taking more. My question was, when you said about sleep appetite, it kind of clicked with me that I lost my sense of appetite when I had chemo, and it's never really returned. And I wonder if our sleep appetite gets impacted the same way as our food appetite.
That's a great question. I can't really speak to food appetite in the context of chemo, just because it's kind of outside of my area. But for sleep appetite, the sleep drive process still exists. We kind of just have to show it where to go. So sometimes our scheduling can get really dysregulated. But if you continue to give yourself time to build up that sleep appetite and delay bedtime when you need to, that process still exists and regulates well post-chemo.
So you don't have any information that chemo itself impacts the sleep appetite.
It shouldn't. It's a chemical in your brain called adenosine that's been shown to be present and effective before, during, and after chemo.
Okay, thank you.
Yeah.
Thank you for that. And I think we'll have one more question here. Linda asks, what can you suggest if I am in the other end of the spectrum with too much sleep each night, 10 to 12 hours? I do have a CPAP, but I have had issues with masks and have tried everything.
Well, first thing I would say is I empathize. Navigating CPAP, and I'm sure you're not alone in this, Linda, with people on this talk, is a very long process, often requiring multiple appointments and mask fittings and different kinds of masks. And and titrating the amount of oxygen and things like that. What can I suggest if you're on the other end? What would you see? It really depends. If you told me with less than 10 hours of sleep, you really didn't feel good, that you need 10 hours to feel good, then it would make me wonder about optimizing that CPAP. That's seeing if there are things we can do to help you use the CPAP more, because perhaps it's taking you more sleep to get your sleep need met because the quality of the sleep's not that strong. Yeah, I have so many like follow-up questions. So I guess what I would say is wherever you got your sleep study done to originally get the CPAP, or whoever you're working on with CPAP now, or if you don't have follow-up, I would suggest connecting with those folks. I'd be curious how related or not this is to sleep apnea or other sleep disorders. You know, there's nothing inherently wrong with sleeping 10 hours, but if you still feel unrefreshed, or if it feels like it's taking up too much of your day to get your sleep need met, then I think it would be worth following up with them.
That was the last of our questions, both from the chat and Q&A. Dr. Solomon, I'd have to say I loved this presentation, and it might also have to be your presentation style, but it was really easy to follow along and super relaxing. Maybe it's because you research sleep. But is there anything else that you would like our participants to take away or make sure they look out for? If there are resources that you want me to share in the email going out to all the registrants, please let me know and I'll include them in that email.
Yeah, well, I want to thank you guys for your time, you know, of all the things you could be doing with your day. It's wonderful for me and also for yourself to make a little time to strengthen your sleep toolkit. These tools are all things that I use myself. And so, you know, it's not that I never have sleep disruption, we all do, but feeling like you have some things to navigate those nights. And then the last thing is, you know, I always say it's so ironic because I've asked you to come here and listen to a talk on sleep. It's helpful not to focus too much on sleep. So obviously it's a fine line. We think about sleep and we try to use the tools, but not to worry too much about your sleep. You know, get the resources that you can. Sometimes we're surprised how well we can function on suboptimal sleep. No one's expected to like totally sleep through the night and have no awakenings or never have hard nights. And so the last kind of metaphor I'll leave you with is you're not aiming for like beautiful crystal sleep that might look perfect, but if you drop it, it shatters. You're aiming for like Tupperware sleep. So it's not that pretty. Sometimes it like bends in the dishwasher, but it's robust and it holds up over time. So if you ever find yourself worrying about some of the details of sleep, you can remind yourself we're going for Tupperware sleep. Like basically it works, you know?
I think that is an excellent example. Thank you so much.
Thank
This has been a lovely and highly educational presentation. And we hope that you might want to come back sometime. Thank you
Thank you for
again.
having me.